Before we start, a word of caution. As you know, STARS provides pre-hospital care for critically ill and injured patients who have sustained severe trauma or debilitating illnesses. It's what we do. As such, some of the details in this podcast may be difficult for some listeners. The STARS mission being explored this season involves graphic descriptions of physical injuries to a youth. Psychological impacts are also detailed. The patient's family and supporters have generously allowed us to tell this story as a personalized insight into STARS.
And for that, we are genuinely grateful. The community and everyone else who was involved welcomed us with open arms to help us tell this story. Having spent time with about 20 people researching it and recording interviews on the phone, virtually, in studio, and right at the scene of the incident, we can tell you this. Our conversations were raw and candid, and as such, some of the details uncomfortable. For this podcast, we've endeavored to tell the story accurately without being too sensational. Still, listener discretion is advised.
And so the fire department then went to dismantle this entire lawnmower, and they had it dismantled in 2 minutes.
I honestly wasn't sure at that time if he was going to make it when the lawnmower came off of him. He was just fighting for his life at that time, and it was something I was really unsure of.
I didn't think when we put him on the helicopter he'd be coming off alive. I was very amazed he was still alive, actually.
Just by looking at somebody, you can kind of tell if they're going to make it or not. From looking at him, I didn't think he was going to make it.
Welcome to Mission Ready, presented by ARC Resources. This STARS podcast breaks down, in detail, one mission each season to give you a stronger understanding of how we provide critical care anywhere and what happens before and after the mission. I'm Deborah Tetley.
And I'm Lyle Aspinall. In Season 2, we're analyzing an emergency response to a traumatic incident where a teenager was run over by an industrial-sized riding lawnmower in Laird, Saskatchewan. This is Episode 4, Transfer of Care. By now, you've gained a solid understanding of the massive team working together to give Drayden Woolman a fighting chance after being run over by an industrial lawnmower. At the scene, several things are happening at once. With the mower still on top of Drayden and firefighters trying to figure out how to best get it off of him, STARS flight nurse Bailey Sinclair begins infusing blood through the large bore IV line that ground paramedics have already put in place, and STARS flight paramedic Glenn Pilon preps for an intubation.
Yeah, he is on ground level. He's on his back. He's looking up to the sky, and he has his right arm sticking out from underneath the lawnmower right beside the wheel. And just from his neck up is all that we can see, really. And so we set up right at the head, and we get all of our equipment out. We get all of our intubation equipment out. We get our bag valve mask out. We get our oxygen out. We go back to the helicopter and we get the blood box. The safety pilot is there to bring that to us, open up the blood and start infusing the blood as we're setting up for other things.
He was kind of in and out of consciousness, just gasping for air. He had an IV in the one arm that was out from the lawnmower. So immediately I started giving him blood while he was still under the lawnmower, while Glenn set up to capture his airway. While I was doing that, Glenn was getting ready for this airway, and I was kind of thinking, what is going to happen once we lift this lawnmower off of him? So a lot of things crossed my mind.
We make one attempt to try and intubate him. As the blood is going into him, we get better hemodynamics. And so we can go ahead and make our intubation attempt. And we use a video laryngoscope to do that. And the video laryngoscope has a cord on the very top of the handle. So if you can imagine kind of a hockey stick that's cut off just above the blade, you have a blade that goes into the mouth, and then a handle that comes up. And on top of that handle is a cord that goes to the video screen. And because it's a very bright day outside, you have a glare on that video screen. So you can do your direct laryngoscope that you can go in and see the mouth. But because he's laying on the ground, you have to also get down as low as you can to see into the mouth, because you want to put that tube into the trachea and not into the esophagus, because you want to assist his breathing. So when I go to put the blade in, the top of the laryngoscope handle, where the cord is, it hits the lawnmower and it is stuck there. and I'm not able to lift up in order to see the epiglottis that I need to see where the vocal cords are in order to pass the tube in. So we had to make the decision to try and do a type of a blind insertion using a bougie, which is kind of a plastic stick that will go into the vocal cords. And what you feel for is the tracheal rings along the front of your throat here. And that fine feeling of a little bump, bump, bump as you're pushing this plastic rod down. And then you would put the endotracheal tube over top of that and into the patient's airway so that you can assist the breathing. But I was not able to see the vocal cords or feel any tracheal rings. So we had to come back out and we had to manually just ventilate the patient using just an oral pharyngeal airway, which is about this far, that just goes just behind the tongue. And we had to make the decision to take off the lawnmower base in order to get that airway in to him to assess his breathing, all the while there's still a blade inside his chest.
The first responders had said that they believed the blade was in Drayden's chest, and they were worried that when they lifted it off that he might bleed out from that site. So I was thinking things about, okay, we might need to apply some pressure, we might need to give more blood, what might we need to do to stop this bleeding when we lift the lawnmower off. I was also worried that if the blade was near his chest or in his lungs, that we might have to decompress his chest. So it's kind of our version of doing a chest tube out on the scene, just to help that lung re-expand if it had collapsed while the lawnmower was on him. So I was thinking lots of other things while getting medications and blood ready for this intubation.
One volunteer firefighter on scene had first-hand knowledge on how to take the lawnmower apart. Laird Fire Chief Chris Dennis talked to us about it.
These lawnmowers, they're not just like normal lawnmowers. They're big industrial lawnmowers, and they're built and maintained and all that right in our town. And one of the lucky things we had that day was the head mechanic in that lawnmower shop is on our fire department. He was one of the first firefighters on the scene. And he was there instructing us and helping us to take it apart, because it was like, if you're going to do this type of stuff, you're going to cause more problems and more injury. He was an integral tool to us getting the lawnmower off of him in such quick time without causing more damage to him.
And so the fire department then went to dismantle this entire lawnmower, and they had it dismantled in 2 minutes.
I honestly wasn't sure at that time if he was going to make it when the lawnmower came off of him. He was just fighting for his life at that time, and it was something I was really unsure of. So once Glenn was all ready for the intubation or to capture his airway, and I had all the blood and medications ready, we got the first responder crew to lift the lawnmower off of Drayden.
It was everyone's first view of the damage the mower had done. One of Drayden's feet was injured from being dragged under a wheel, but worse, there was a large hole in his chest, and his left arm was mostly severed. First responder Caleb Burrell was holding the bag of blood that was going into Drayden's other arm.
At that point, they had given him medication that put him under, I guess. So, he wasn't speaking anymore. But we got him out and could see the extent of the injuries. And I've never seen anything like it, and I honestly don't want to see anything like it ever again. And I did. I was holding the blood bag, and one of my fellow firefighters asked, do you want me to take over? Can I hold this? And I was like, no, I'm good. I wanted to do more. This is all I can do right now is hold this blood.
When you lift the lawnmower deck off of him and you see a hole in his chest the size of a football, and I didn't think when we put him on the helicopter he'd be coming off alive. I was very amazed he was still alive, actually.
When they lifted the lawnmower off of him, we could see that his left arm was severely injured. It was gaping open, hardly attached. And then he also had a large injury to his abdomen.
And he had this high visibility vest that was on him. It was all twisted around and in a ball on his chest and completely covered in blood. And we were successful in intubating him at that time.
So Glenn got the airway, everything went really well. and we actually were able to get Drayden out from under the lawnmower onto our stretcher.
And we were able to get the second unit of blood started into him as we moved him towards the helicopter.
Their off-duty manager, Daniel Kobalak, who was standing nearby, got on the phone to update STAR's transport physician, Dr. Shagun Oyadokin, who you heard from in the previous 2 episodes.
It was a very busy scene, as you can imagine, and Bailey and Glenn were doing an amazing job taking care of Drayden. And I just looked at everything that was going on, and I thought, now's a good time for me to just step back and update our transport physician and make sure that the receiving center knows as well, too, what's about to come in.
Charlene speaking.
Charlene, Daniel here, backing up to 11. I need Dr. O, please.
You got it. 1 moment.
Thanks. Hello?
Hey, Dr. Oyadokin AMC on the line. 1 moment.
So, Dr. O, we just got the mower deck off of him. I'm just here helping Glenn and Bailey. He is quite down. We still do have a faint pulse, significant trauma to the chest, and the whole thoracic cavity is open from the mower blade.
Is it gone through the thoracic cavity? Did it perforate the lungs, do you know?
Hard to tell. There's quite a bit of trauma there right now. We're just working on getting that airway in place, and we'll be transporting here soon. I just want to give you an update. Thanks.
Absolutely.
Thanks. Bye.
Okay, bye.
Thanks, Dr. Oyadokin.
Charlene, do you want to put me through to Pete's emergency doc, please?
You got
just so I can give them this update, yeah.
Yep, give me 1 moment.
Charlene Ernst in the STARS Emergency Link Center patched him through to the on-duty pediatric emergency physician at the Jim Pattison Children's Hospital.
So just a quick update, they were just able to get the lawnmower off of him, and he has a huge right chest wall wound. So blood pressure is very low. They didn't quite give me a number. They're giving blood, they've given TSA, they're trying to secure the airway, and they're trying to package him as soon as possible. So as soon as I get more details, I will let you know. So right now, they're trying to secure the airway, and they're trying to resuscitate.
So they're tubing him basically, and
yes,
they'll tube. All right. Any other injuries other than the chest that we know?
There's no extremity injury, but
Back in Laird, the STARS helicopter was parked roughly 100 meters from the scene, across a gravel road and near a gazebo in a large public park. As pilots Alex Pera and Yves Bolduc started it up, Drayden was strapped onto the stretcher and several helpers began carrying him to the open rear doors. First responder Kevin Burrell was among them. He had been in Saskatoon when the call originally came in and had seen the STARS helicopter leave the city when he began driving to Laird.
So I didn't have any gear on. I was just in my normal street clothes. So just by seeing what I saw, I could recognize that they were getting close to loading him up and taking him away. So I went to one of our firefighters that was in full PPE and wasn't a first responder yet. I said, you go over, work the landing zone, I'll take over here for you. So I took over what he was doing. We got him onto the spine board. They already had an IV going in him. We loaded him up onto the stretcher, strapped him on. We had to put his arms up on, and that was kind of scary.
However, Drayden was finally on the stretcher and free of the lawnmower, and it was then that the first glimmers of hope began to emerge. Here's flight paramedic Glenn Pilon.
I think my outlook on Drayden's future changed when we moved him from the ground to the helicopter stretcher. And we had our cardiac monitor on there. We had a blood pressure on his leg. We had a pulse oximetry on his finger. We had cardiac monitoring on him. And when I saw all those numbers, and I loved those numbers, that's when my outlook changed for him.
I love your big smile there. The audience can't see this, but you're smiling.
That was the turning point for me, because when he was underneath the lawnmower, and imagine this, that you're infusing blood into his right arm and you have an intravenous in his elbow, you need to put a blood pressure cuff on that right bicep, and that has to squeeze, and that's going to stop the blood flow that we're trying to infuse into him. So we have no blood pressure other than just palpating his carotid artery, and we know that by doing that his blood pressure could be as low as 50 systolic. So we didn't want to put a blood pressure cuff on his right arm and have the possibility of stopping the blood and also losing that intravenous that's in his right elbow. So we decided not to put the blood pressure cuff on him while he was underneath the lawnmower with the lawnmower on him. Once we had the lawnmower off, we could cut off his jeans, get him on stretcher, and we could put the blood pressure cuff on his leg, which gave us a number. And that was our turning point for me.
It was a turning point for Bailey as well. For the first time since their care began, hope emerged for her too.
In flight on our way back, we were able to get some vital signs. We were able to alert the hospital that we were on our way, that they would need some blood ready, and that they needed the trauma team there and ready for Drayden to meet us there because this kid was very, very sick.
Are you able to hook me up with our TP, please?
Yeah, one sec, Bailey.
Hello.
Hi, Dr. Udokin. Just have Bailey with Star 11 looking to connect with you.
Okay.
Bailey, Dr. Udokin, go ahead.
Hey, Dr.
Bailey.
Udokin, it's Bailey. We have just got him loaded. We are going to be back in Saskatoon in hopefully about 16 minutes. We're running our second unit of blood. We've pressure infused 1 gram of PSA. Do you want another gram?
Yeah, just you give a second one. Give a second one. That's okay.
Okay, sounds good. We are just about to load, so I'm probably going to lose you here, but we will be in Saskatoon shortly. Okay, thanks, Dr. Udokin.
Okay,
Bye.
all right.
Star 11 Link Center, go ahead.
1553, thanks.
And Star 11 Link Center, transmission broke off. I did copy you were up at 1553. Your landing zone has been requested secure at Jim Pattison.
And just be aware, we're going to need at least 2 units of blood to get ready for us. We're using our blood.
Star 11 copy 1556 and copy remarks in regards to the blood.
And now, a quick word from our Season 2 sponsor.
As Canada's third largest natural gas producer and the largest producer of condensate, ARC Resources is proud to play an important role in the responsible development of Canada's energy resources. In delivering those resources, safety is the #1 priority, always. And it's that core value that makes ARC's partnership with STARS a natural fit. It's our shared goal to ensure that everyone arrives home safely at the end of the day. Learn more about how ARC is leading the way for safe and responsible energy development at arcresources.com.
Welcome back. Drayden wasn't the only non-STARS passenger on board the helicopter for that flight. I asked Yves Bolduc, the pilot who flew this mission, about the extra ride-along. So we understand that something rare happened on this mission, and that is we took Drayden's mom in the helicopter. Can we talk about that a little bit? How rare it is, how we make those decisions, what protocols, what do you guys discuss when taking along a mom or a dad?
The consideration was at the time, because his injury was so severe at the time, they did not know if he was going to make it or not, right? Therefore, at least, to have a mom that was there. But not only that, her mom, has a background in healthcare as well. So we knew that we had someone that understood what our medical crew was doing. It was a mom that understood, that she needed to be calm for the sake of her kid and for the sake of our crew that needed to be focused on, keeping him, as stabilized as possible until they got, to the emergency room. Okay, so that was the reason why there was no question about it, for that instance.
Alex Para was a safety pilot on this mission, so it was his job to prepare Drayden's mom.
And I did remember just telling her, whatever happens in that helicopter, just let them do the job. He's in a good hands. Don't panic.
Flight nurse Bailey Sinclair said Christine was a model passenger.
That was a bit of a different experience having her along, but it didn't change what we did. I remember thinking, what must this feel like for her? She was so calm and collected and cooperative. And I could not believe how well she was handling it when her 16-year-old son, when she had just seen him under a lawnmower like that. I remember just thinking, I can't imagine how she's feeling.
Glenn said although it's rare for a parent to join a flight like this, he prefers to do it whenever possible. It's always assessed on a case-by-case basis.
Yeah, absolutely. There's one of the things that we can talk about on the way out to the call if there's a parent there, especially for somebody under the age of 16 that's a pediatric patient is going to be going to the pediatric intensive care unit. We want to bring a parent along with us. And so we told our safety pilot that we want to bring mom with us, and then mom gets a safety briefing where she's going to sit on the helicopter and how to put the seatbelt on and how to take the seatbelt off in case of an emergency and stuff like that. So the safety pilot is doing those things while the other pilot is in the helicopter with the helicopter running. And so yeah, it's a busy little environment. And sometimes you wonder, are you going to have two patients on that helicopter in that flight back to the hospital? Because not only do you have the critical injured pediatric patient, but you also got a distraught mother that's with you too, that can take up a lot of your time when you need to focus your time to the pediatric patient. Those are things that you deal with on scene. You kind of assess what the mother is doing at the time when you're trying to work on their child. And if you see that the parent is quite frantic and is in a lot of shock, Bailey and I would have that discussion on the way to the helicopter to say maybe we shouldn't bring mom along. Maybe mom should go in a family vehicle to the hospital because we're not going to have time to deal with that. But she was incredible. She was so calm and collected. We knew that we weren't going to have a problem or deal with the mother on the way to the hospital, as well as dealing with a critical injured pediatric patient.
Remember in a previous episode when Christine said she, quote, corrected her behavior when she found herself acting on her emotions upon arriving at the scene? Well, she said she used that same discipline inside the helicopter.
They sat me into the helicopter, and I saw them bringing Drayden, and then they loaded Drayden up, and we took off, and I just first of all, I didn't really look at Drayden, because I didn't know exactly what I was dealing with. So I would just look out on our town as we were leaving, and then I looked at the monitor, and I saw that his vitals were good. So I'm like, okay, he's going to make it. And then I did see like a bandage over his chest, and that's all and then I thought, nope, I'm just going to look at the monitor, and then I looked outside. And that's all I just kept doing, is I just kept looking back and forth. And then I did see the paramedic on STARS. He had an ultrasound on his phone, which I thought was really cool. And then so I kind of saw that, but I didn't see what he was looking at.
That was Glenn operating the ultrasound. In fact, he was doing that in one hand while at the same time essentially breathing for Drayden by regularly squeezing a manual resuscitation bag in his other hand, something he would normally leave to a machine. But it was such a short flight, it made sense for him to just do it himself.
While bagging with my right hand, I was using my left hand to assess for pneumothorax. And so I was using the ultrasound and looking at the ultrasound to see if there was lung sliding on the ultrasound, to see if he had a collapsed lung from that blade being in his chest. And he did not have a pneumothorax.
It just gave me chills.
So, yeah.
I can't imagine that. I mean, I've been in the helicopter while a mission's going on, and it's loud and it's moving and it's shaking, and in one hand you are manually bagging, in the other hand you've got an ultrasound going on, and Bailey's doing her thing, and at some point in the 17-minute flight, somebody's got to talk to the hospital and tell them what's incoming. What are you telling the hospital at that point?
Yeah, it's only a 17-minute flight, so you want to give them as much notice as you can so that they can prepare and have all their teams ready to go when the patient arrives. And so there are a lot of things that need to be done in the helicopter in that 17-minute flight, and it can get quite busy in there.
Star 11 Laketon, go ahead.
Are you attached to RU8, please?
Star 11 Roger, stand by for patch.
Teacher Laird, yeah.
We're inbound with a 16-year-old from a scene call up in Laird. You guys are aware of this patient coming in?
Yeah.
Perfect.
Yeah.
So our crew is looking to do inbound patch. I will link you in now, okay?
Okay.
Star 11 Medicals, Link Center, you're online with RUH Peds Emerge. Go ahead, please.
Angulated deformed left arm, and we have a heart rate of 176, a pressure of 70.
And there's another unit of blood that needs to be infused in the helicopter on the way to the hospital. So Bailey is busy, and We also have to sedate the patient too. If the blood is starting to perfuse the brain, then the patient starts to wake up. And then when the patient starts to wake up, they can reach up and they can grab the endotracheal tube and they'll pull it out. So Bailey has to also sedate the patient and draw up medications to keep the patient sedated as well. So it's a busy 17 minutes in that helicopter to the helipad.
But I remember just feeling a bit of relief when he had some pretty good vital signs and felt like we were going to be okay to make it to the hospital. We were going to get him to his next step of his care.
Yeah, so we land on top of the helipad at the Jim Pattison Children's Hospital, and we go down to the trauma room, and there is a massive team waiting for him, and we hand over care and we give our report, and they do their thing.
I used to work in the emergency department, both the adult and pediatric emergency. So taking Drayden down the elevator and into the trauma room, I saw a lot of my colleagues. I saw the whole trauma team waiting for him. I saw the pediatric emergency team waiting for him. There was just so many people who were there to help Drayden. And I remember just feeling such relief that all of these people and all of these capable, amazing healthcare providers were there to help Drayden. And I think that was just a sense of relief for me, was we got him there safely, and we got him there alive. And now it was up to these people to take over and continue on with Drayden's care at that point.
And obviously, because you'd work with them, you knew that he was in the best of hands, right? Like, that must have felt very confident for you.
Yeah, absolutely.
They start getting blood work drawn. They do CT scans. They take him to the operating room, and just incredible, an incredible team to hand over care to. It's just.
I know Christine was pretty amazed by what she saw on the receiving end in the hospital.
Yeah, absolutely. For a mother, like to be in a parent's perspective, like to finally be in the hospital and you know that you're kind of out of a little bit of the woods. It's a great feeling to have.
Let's hear it from Christine. Remember, she's a trained first responder, and she was still in uniform from having rushed away from her day job at a nursing home when she first heard about Drayden's injury.
And I followed him, and they brought him into this room, and there was like probably 20 people with yellow gowns just surrounding him. It was so cool to see. It reminded me of bees going to a hive. It was just so cool. I'm standing there just watching and observing. And then the social worker comes up to me and asks me, "Are you Mom?" And I says, "Yes, I'm Mom." She goes, "I can't believe how calm you are right now." And I said, "Well, panicking doesn't help." And I said, "Most of it has to do with my training." And then she goes, "Yeah, but you're blending in with my staff," because I have my scrubs on from work. And then they went and took me into a room where I sat with her for a little while, and 3 doctors came in. And they told me that his arm was cut in a million pieces and that they could try and salvage it, but they said that it wouldn't be functional and it would be dead. And they said that there's risk of infection, and I just said, "You do whatever you got to do to save his life." And they left, and then the other doctor, this is what I was waiting for, he told me that Drayden's muscle was just shaven off of his chest and that his ribs were actually cracked upwards. And that's all that had happened. And I'm like, okay. And right then and there, I knew that God was there. And then afterwards, they had surgery, and then we were in ICU.
Drayden did have a massive wound to his chest, but surprisingly, the mower blade narrowly missed puncturing his lung or causing significant damage to any major organs.
His wound was like, it was 20 centimeters by 20 centimeters. And when I was reading the doctor's reports, it said that there was grass, dirt, rocks, and all that all around it. And they could see his right lung and his diaphragm. But there was like nothing inside. And I thought that was amazing. So at first, they were really concentrating on his arm and his chest. And then after we found out that he had 2 fractures in his hips, and then he had a huge blood blister on the bottom of his heel from being dragged.
But what about his arm? After all, his left arm was under the mower deck, and we heard earlier from Bailey that it was significantly damaged. Well, the moment Drayden came out of his induced coma, he had one very specific question for his mom.
When he was in the induced coma, I would get my family members to talk to him just so that he could hear their voices. And I was on the phone with my cousin Sheldon. Sheldon said, "Hi, buddy," to him, and he opened his eyes, and it freaked me out. And I'm like, and I go to the doctor. He's, "Wait." I said, "Sheldon, I got to call you back. You just woke up." So they ended up taking the breathing tube out shortly after that. And when they did, the first thing that Drayden asks is my arm gone? And I said, "Unfortunately, yes. But it saved your life."
Next time on Mission Ready.
You said something earlier that you were talking to yourself in your head. What were you saying?
Well, I'm not going to bleep die. I'm not going to bleep die. I'm going to figure out how to get out of this.
Drayden, in his own words.
That's why I was repeating to myself in my head.
Mission Ready, presented by ARC Resources, is produced in-house by me, Deborah Tetley.
And me, Lyle Aspinall. Watch video clips from this season at stars.ca/missionready.
Mission Ready contains original theme music by Kaya Gamble, whose dad was a longtime Stars pilot and whose mom was once a transport physician. Check her out at kayagamble.com. Please rate and review Mission Ready wherever you found it, and be sure to tell your friends about it. Also, check out Season 1.
Want to be a STARS ally? Get involved and support our mission by visiting stars.ca. Until next time, thanks for listening.